New at 10, children desperate for care waiting to be treated.
Is there a psychiatrist shortage here in Wisconsin?
Yes, no question about it.
Tonight, Elise Preston digs into what experts are calling a health crisis.
The shortage is so bad, doctors say families are waiting as long as 2 years to be seen by a child psychiatrist. It sounds unimaginable, but for many Southeast Wisconsin families, it's their reality. On a cold winter day, Mom Maria Rivera smiles warmly as she flips through old photos of her daughter Mariana.
She's playing the guitar, but I'm like, she doesn't play the guitar. I don't know where she got that guitar from.
Mariana is now a teenager.
In the house, she's very caring and warm, and she loves to bake. Like any other kid, she fights with her brother.
But the teen also has a different fight. For several years, she's battled mental illness.
They told us that she had anxiety and depression.
Mariana was first diagnosed after Maria noticed small, typical tasks were crippling for her daughter. She was 12 years old.
How long does she say that she's dealt with anxiety?
She tells me since she was probably 7 or 8 years old.
The delayed diagnosis made the mom feel
powerless. It also made me feel guilty because I didn't notice earlier, and I felt like she was suffering and I didn't know.
For years, Mariana did not suffer alone, getting counseling from a psychiatrist who also managed her medication. But this past August, when the family moved to Milwaukee from Madison, they had a tough time finding a doctor to help treat Mariana's illness. The wait list to be seen, almost a year.
When they first told you 11 months, what did you think?
Well, first I felt desperate because we need care.
To think about the suffering that occurs with mental illness that these kids have to endure while they're waiting to get that help. It's heartbreaking.
Dr. John Lehrman chairs the Psychiatry and Behavioral Medicine Department at the Medical College of Wisconsin. He calls the lack of access Wisconsin children have to mental health care a crisis.
It's an absolute shame. It's a crime.
Saying only about a third of those suffering see an expert.
Wisconsin ranked 50th out of 51 in access to child mental health care for children who have had a major depressive episode.
Adding that out of 72 counties in the state, 49 don't have pediatric psychiatrists, forcing many families to seek help in Milwaukee County, which already only has a third of the doctors needed to keep up with the demand.
It's unnecessary because we as a society should have better care. This is something that's not acceptable.
Lehrman believes the shortage is partially fueled by stigma, with many families not talking about their struggles and doctors not choosing to go into the specialty. It's a stigma Maria knows all too well.
It's just a disease. It's just a disease. And if we treat it as a disease, we don't have to be so negative about it.
Mariana now gets treatment in Milwaukee. For months, she and her mom drove back and forth to Madison. They waited until she turned 18, making it much easier to see an adult psychiatrist locally.
You would still be traveling to Madison had she not turned 18.
Correct.
Lehrman believes salary increases for psychiatrists and the rollout of new programs to help Wisconsin families will give others hope.
What is your greatest hope for your daughter?
That she will be cured like with all the diseases.
One of those programs Dr. Lehrman is excited to see expand is the Child Psychiatry Consultation Program. It's a network that allows pediatricians to get guidance about their patients from psychiatrists. We have information about that network and other programs on our website, tmj4.com. Elise Preston, today's TMJ4.